you like to do today?
I would like to focus on the lines right here in between my eyebrows. My eyebrows. They're a little deep for me, and so I'd like to minimalize them. And also around my eyes, I'm finding that I'm getting, as I get older, a lot more wrinkles and crow's feet and smile expression lines, and just dryness in different places on my skin.
I think we can get some great results with your skin. I think that what we can do with the intensive serum and what it's meant to do is help restore the health, the luminosity, and also that brilliance that you had when you were younger.
Okay.
When you're younger. And you know, as we age, we lose our growth factors.
Yeah.
And so applying topical growth factors with a delivery system like this microneedling stamp will help introduce those growth factors deep underneath the epidermis of the skin. So it's very fine needle.
So it's not painful?
It's not painful. It might be just a tad uncomfortable in areas,
okay.
Especially, maybe right underneath your eyes and close by your nose, but it's not something that's unbearable. No. Okay. On a scale of 1 to 10, it's probably a 2.
Okay.
And we will stop all the way along the way. You'll tell me how you're feeling, and I'm going to tell you what's happening.
Okay.
So this is the product that we're going to be using on you today. This is our intensive serum. So this is our clinical grade growth factor. So this is the highest quality on the market right now growth factor. So this is only to be used in a physician's office and in a clinical setting. So here's how the procedure is going to work. I'm going to start with placing the serum on your face first, and I like to place it in 4 different areas, and we'll just do little drops in that area. I will then smooth it on your skin, and then we were going to do 1 pass with the microneedling. Okay. And we'll start at the top of your forehead. I will then use another 1/3 of the product, spread it over your skin, your face and your neck, and then we'll do another pass with our microneedling stamp, and then we'll finish off with the last 1/3 of the product.
Okay.
It takes under 15 minutes. You will have some slight redness, but within 15-20 minutes it will dissipate, and then you're able to go back to the office and go back to doing whatever you're doing that day. The only thing that we would ask is that you do not wash your face until the next morning. You want to leave the growth factor product on for as long as possible. We'd like to see at least 12 hours that these growth factors have the ability to absorb and then start to regenerate the skin.
Okay.
So here we're going to start with the first process. I'm going to draw out my first 1/3, and we're going to place it right here on your forehead, on your cheek, on this cheek, and a little bit on your chin. Okay, we just do a nice, gentle application. The key to this product is not to rub it into a lather and not to be too aggressive with it. We really just want to make sure that we do a nice even film over her face. Make sure that you get into that crow's feet area, as I am right here, that you get right into the corner of the nose, right across the top lip, and then right on down to the chin. And how does that feel?
It feels nice. It just feels like a serum. Okay. There's no
stinging,
discomfort,
no burning.
No.
Okay. So what we're going to do right now, I'm going to start my first pass with the microneedle stamp, and I'm going to start right between your eyebrows. Right. And I'm going to start with just a light pressure, and you're going to tell me how that feels.
Okay. That's fine.
I'm now going to just open this little crow's feet area, and I'm going to take my microneedling stamp and go right in there. That's the thing I like about a stamp as opposed to a roller. I have more control using the stamp than I do with a roller, and I don't really like tearing up the skin as it's rolling back and forth. And as you can see, as we're going across her skin, that she's starting to get a little red. Those growth factors are already starting to enter into that skin level and start to work. I'm going to go right down, right on her jawline, So how are you feeling? How's the comfort
It's fine.
or discomfort?
Yeah. Some places are like at a 1 and others still at like a 0.5, so it's not painful.
Good. Right now I'm just going to go on the other side. And I'm overlapping just slightly on my grid pattern.
How do you know how much pressure to use?
I can tell pressure when I look at the skin. You know, everybody has a little difference in skin thickness depending on age, ethnicity, exposure to the sun. There are quite a few different factors. And looking at her skin is actually fairly fine. And I will always start with a lighter pass, my first pass, and always ask her about how comfortable she is. And when we go to the second application, I will be a little bit more aggressive. Usually, you know, gentlemen's skin, you can be a little bit more aggressive with. Just depends on their nationality. And
Does it also have to do with shaving?
shaving, other skin issues. You know, if they have acne, do they have any rosacea? Do they have any breakouts? Those types of things as well. So that's my first pass. So we're done with that. I'm going to go again with more growth factor. Our growth factors contain TGF-1, 2, and 3, platelet-derived growth factors, interleukins, and cytokines. So we have a very purposeful mix of growth factors designed to deliver the key benefits that we would like the skin to have. Now, she's going to start to see the effects of this microneedling procedure about 4 days later. And here's what she's going to notice. She's going to notice some tightening and toning of the skin in general. She's going to notice some luminosity return back to the cheek area and the eye area. She will notice some reduction of fine lines right around the eye area. And she also will notice reduced inflammation if she has issues with breakouts, rashes, those types of things. And since this really kind of has a cumulative effect, she's going to see her skin improve over the next couple of weeks, and she's going to be really happy about putting her best face forward. We've also seen lightening of pigmentation. It certainly won't get rid of all the pigmentation, but it will start to help reduce some of those dark spots from sun, just from environmental exposure. And I think one of the benefits that most of our clients talk about are the reduction of the pore size. They are really excited that they've had issues with pore size around their nose, around their mouth. They're excited to see their skin return to having some of its healthy glow again. They're not wearing as much makeup. You may even find yourself not wearing as much moisturizer as you used to. Because of the homeostasis process and the cell turnover to seeing that cell return to its ultimate healthy environment, you may not need to use moisturizers. You're going to see dry skin become less dry, and you're going to see oily skin become less oily. So we have this natural regulation of skin and skin tone. I just want to be sure I go right in there. So how does that feel?
It feels fine.
Good. And at times we have done noses. We can go up into this area right in here. Right in here. I don't normally do the bridge of the nose. There really isn't a reason to do that. You can still use your micro refining serum, some of the intensive serum, and still get some nice benefit with that. That I just find that most people really enjoy having this area and corners of the eyes, corners of the mouth, and the chin and the jaw done, just because that's where they're going to see the benefits.
Do they do the
most.
neck a lot, or?
We can do the neck as well. Usually you would, if a patient came in for that procedure to do a face and neck, you would use 2 vials for that. We can do a neck, we can do your chest, we can do hands, pretty much any place that you'd like to see improvement. And this, you know, when we're done with the procedure, it takes just about 10 minutes or so for this to completely absorb into your skin. You're not going to feel oily, greasy, sticky. It just dries to a nice, tight, toned feeling and appearance. So you can see I'm just going right underneath the jawline right here. I don't go back behind the ears, but I go right through here. You know, the neck area is probably one of the more difficult areas to work on, not only in this type of procedure, but also for laser. It's just that as we age, we get deeper creases, more crepage, if that's even a word, and it's harder to tone this area. So I think this is a perfect procedure to use to help tighten and tone this area right in here. And a little bit of this serum goes a long way. This is a medical clinical grade growth factor. And there she is. She's all done.
Wow.
She does have the reddening there, but that's typical because what we're using are tiny needles to introduce slight injury to the skin that will create growth factor production from underneath, and then we are applying topical growth factor. So in essence, we are creating what I call a super serum and a super anti-aging procedure.
And then after that, at home, what type of follow-up?
At home, then what you're going to do is that you are going to be applying our maintenance product. So that is our everyday micro refining facial serum. That's applied twice a day, in the morning and in the evening on clean skin. So tomorrow morning when you get up, you take a shower and clean your skin and do whatever you do with your regimen. You're going to apply this on first. This is always the first thing that is applied. It's a foundational serum.
Okay.
And then you will also apply your eye serum. And if you'd like, one of our newest products is our eyelash enhancement product. So if you'd like, I'm going to apply just a little bit of eye serum on for you so you can kind of see what it looks like with regard to texture.
Now this is for the eyelashes?
No, this is for your eyelids and
Oh,
underneath
eyelids.
your eyes here. Because I can't get that
dermis,
close underneath your eyes just because of a little bit of risk, we have formulated an eye serum with growth factors that are specific to the skin underneath the eye. That skin is a little bit more delicate and needs just a little bit different delivery system.
Okay.
So if you'll look up, what you would do is you would apply this eye serum just like this, just right underneath the eye. Now if you close your eye, and you can just go right over.
Oh, it feels nice.
Like
and
that.
It smells nice.
Yeah, it has a nice fresh smell to it. I'm going to just go on your other eye. Just keep your eye closed. Just go right there and you just apply it all the way up to the brow line and right to your lash line. And now if you look up on the other eye, and I'll just this right there.
Wow.
That's it. And if you want, I mean, your final, the icing on the cake,
Ooh.
that I like to call it, is our eyelash serum.
Yeah, explain that.
Eyelash serum, we've been able to harness growth factor technology that will help strengthen the lash follicle and the eyebrow follicle. So just as in other products, you would apply this daily. I suggest twice a day, just to keep everything in consistent and to keep a consistent regimen. Because I find if I do things same way every day, I'm gonna be consistent about it. And I think that's the key thing about using these products or any other product. To get the best benefit is to be consistent about using these products. So for this product, we have these sponge applicators that will catch the product and absorb the product and help with the ease of application.
Okay.
So as you can see within the diagram right here, you're going to place the product on your applicator, and then you're going to place it right along your lash line, right along right here, like you would eyeliner.
Okay.
It's very easy to apply.
Okay.
So you can use one applicator for both eyes. So I'm just going to drop. You're going to do 2 drops. Close your eye. And you're just going to start right from the corner of your eye all the way to the end. And it's as easy as that. I'll go to the other eye. Start from the corner. And then go just like that. Just wait for a few seconds and open your eye. And that's it. You can also use this to apply underneath your eye if you'd like, and also on top of your brow. Oh. It's just your own preference.
Can we try the brow?
Absolutely. So it's going to be the same application. Close your eye. You always want to make sure your eye's closed. You don't want anything going in your eye. Though if it does, it's not going to hurt. And you would just go over the top of your brow.
So for people, as we know as we get older, that we sometimes lose our eyebrows or our eyelashes, this will help stimulate that growth?
Yes, it will stimulate healthy follicles and stimulate healthy growth. So what we're seeing is not so much rapid growth like in other products. We're seeing slower, thicker volume.
That's
growth.
what I would want, is the thickness and the volume.
Right. There is enough product in this applicator. It's a 7 ml applicator to last you for 2 months.
Okay.
So it's not only is it a good value, but it's
Cost effective.
Cost effective and a great product to get what you'd like to achieve. And then you would continue to use it for as long as you'd like. You can take breaks, and then when you get to the point where you feel like you might need to use it again, you might see a little thinning in your eyelashes, because we naturally lose hair and eyelashes, then you can start it up again.
Okay. I didn't know what to expect at first. I was a little hesitant when she showed me the needle, but it didn't hurt. It made me sneeze a little bit, but it felt fine. As everyone keeps telling me, I'm not that red, and it feels good. My skin feels moisturized, and I can't wait to see the results in 4 days. I was really trying to focus on these 2 number 11s in between my eyes, and so I can't wait to see how they continue to minimalize. After she did the first pass, you could feel the serum kind of going in. Didn't really have any tingling or anything like that. It just, you could feel it kind of going in. When she did her second pass, it didn't hurt at all. You could see that she was probably going a little deeper, and then the serum, like right now, I can feel the serum still sort of seeping into the skin. My face feels really good. I love the way it feels, so I would definitely do it again.